Bon après-midi tout le monde. Hi everyone. I'm just going to get started. I've had a very busy weekend, a very busy day, so I might not be able to cover everything that I usually do today. I haven't had time to really look at all the data, but just to let you know that province-wide we're up 3,338 cases, which again kind of stabilizes the numbers. I know that we had peaked at 4,000 last week, and we're sort of revving up at that number. And again, it's stabilizing but very high, and so we're quite worried about that. Again, the most of the biggest drivers are Toronto, Peel, York, and Niagara, Waterloo this time, and we've had our share of cases, which I will explain in a short while. Donc, au niveau de l'échelle ontarienne, on a augmenté nos cas de 3 338 depuis le jour précédent. En total, nous avons 219 120 cas avec 5 012 décès. La plupart sont à Toronto, GTA, etc. Par contre, nous avons des chiffres augmentés aussi. Hospitalizations have gone up. They're 1,563 provincially and 387 in the ICU. And ventilated patients are 268. Donc, au niveau de l'hospitalisation, on est rendu à 1563 en total, avec 387 patients aux soins intensifs, 268 sous ventilateur intubé. So these numbers, we've been seeing them creep up, as you know. ER numbers have gone up, and so on. Locally, our hospital, particularly our Cornwall hospital, is experiencing the increased capacity. Most of our patients, not all our patients, are at that hospital right now, and so. Donc, au niveau local, nous avons notre hôpital principal qui reçoit les patients de COVID, soit l'hôpital de Cornwall est débordé, c'est beaucoup plus que capacité, et en effet, la plupart de nos patients hospitalisés de COVID sont au Cornwall actuellement, incluant aux soins intensifs. One of the things I just wanted to go over is I'm going to take some time today and go over our statistics, and then I'm going to go back and go and give you some updates and some new data that I'll be presenting moving forward. Donc, je vais commencer avec nos statistiques locales qui démontrent une augmentation pas mal importante, et je vais continuer avec des autres chiffres pour vous qu'on a eu aujourd'hui. Donc, au niveau de notre région, nous avons maintenant 695 cas actifs, et nous avons... En effet, nous avons augmenté, juste pour voir, nous avons augmenté pas mal. On a ajouté 166 cas depuis vendredi. Et vous pouvez voir comment c'est séparé. 35 à Prescott-Russell, 39 à SDNG, 71 à Cornwall, 21 à Akwesasne, donc un total de 166 cas ajoutés. So you can see that we're now up to 695 active cases. We're approaching the 2,000 mark of our cases. And we added over the weekend 166 cases, which include 35 from Prescott-Russell, 39 from SDNG, and 71 from Cornwall, as well as 21 from Akwesasne. We also had added 2 more deaths, unfortunately, 2 deaths from the long-term care facility in Akwesasne. Again, tragic, those age groups. If we look at, et nous avons ajouté 2 décès qui viennent de maison de longue durée à Akwesasne, c'est tragique. Again, our outbreaks, we have 14 outbreaks. Most of them are in our long-term care facilities. And it's broken down in this way. And again, as I said last time, I won't have time to go over them individually, but the majority are only staff, not residents, but we do have several with residents as well, particularly in the Lancaster one as well. Donc, nous avons encore 14 flambées, et la plupart sont dans les maisons de longue durée. Et la plupart, comme j'ai dit la semaine passée, sont des cas positifs du dépistage des employés et non résidents. Par contre, on avait au moins 3 qui ont des résidents positifs aussi. Donc, on travaille avec ces institutions pour les supporter. We're also right now at 18 hospitalized patients and 5 in the ICU. Donc, on a 18 patients hospitalisés et 5 aux soins intensifs actuellement. L'autre statistique qu'on veut voir, c'est vraiment, vous pouvez voir, on est vraiment haut au niveau, on peut le voir au niveau de la moyenne de 7 jours qu'on voit sur 100 000 personnes. En effet, on est beaucoup plus élevé en moyenne ici, l'orange, que on voit au niveau de rouge. Donc, on est dans les zones gris, mais on peut voir que Cornwall a une augmentation importante et on a comme un plafonnement ici au niveau des autres régions à la moyenne. So you can see here that clearly for all our area, the dark one here is EOHU, and the light one is for Prescott-Russell. But you can see we're clearly above that red line, which is 40. We're in the 100, 92 and 100 range, and very high in the Prescott-Russell range, in the Cornwall range. That's because we've added so many in recently. Well, we want to see sort of what the trends are moving forward. And so clearly this is gray zone material. We're right in the gray zone at this point in time. We're also going to start reporting our, I don't know where it is here, but we will be reporting our percent positivity moving forward and our reproductive number as well. But then you could see we're clearly here. So although we're seeing maybe a downshift downwards here and a downshift here, but we're still clearly in the gray zone. That would be in a lockdown zone anyway, regardless. Donc, au niveau, juste pour voir ici sur la carte, on voit encore, on a des cas à travers de notre région, mais la plupart, on voit cas actifs à Cornwall, Glengarry, on voit des cas actifs, et puis on voit des cas actifs au niveau de Clarence-Rockland, Russell, dans cette boue ici aussi. This is sort of the picture of all our numbers here, again, we're now looking at very high numbers in our area, but this is not different from the rest of the province. We're seeing upwards there as well. I want to now share this presentation with you. These are some new statistics that I wanted to share. Essentially, this is our latest epi curve, and you can see provincially, how our numbers have gone up. These are the daily cases, and you can see sort of the high spikes that we're going on a daily basis from when we started the pandemic. This here is a indication of our what's called the reproductive number, which now is at 1.36 as of January 7th, and you can see going up and down. Last week we were about 1.5, a bit above that, but now we're down to here. That is really, we want to be below the 1, because above the 1, it is the measure of potential infection or contagiability. Donc, au niveau des statistiques, j'ai montré tantôt qu'on a les jour par jour, j'ai démontré, et ici, on voit ce diapo qui démontre le taux de reproduction, le chiffre de reproduction, autrement dit, une personne pourrait infecter 1,36 personnes, disons. Ça, c'est en effet. Donc, on peut voir que nous, on était à 1,5. Là, on est rendu à 1,36. Encore, c'est un chiffre qui nous met dans la zone rouge au moins, avec tous les données que nous avons. So again, this is another factor. This is an interesting one, and I'll go over some of the acquisition. This is basically acquisition where these have been gotten, and this is put together by Public Health Ontario. And you could see this light sort of blue here, this turquoise here, is basically close contacts, and the orange here, which is presumably, which is very low comparatively, is really the no known epi-link. We have some with missing information, because you can see most of it we do have information in these cases. You can also see outbreak associated. Again, these are outbreaks mostly in our long-term care facilities where we have a lot of cases in certain situations. But you can see kind of the majority of our cases very quickly by looking at it this way are close contacts in the community, and I will talk a bit about that in detail later on. You can also see that we have relatively, compared to before, you see a lot of the purple cases were travel related initially early on, but now you can see that travel is lower, is low, is less than 10% of the cases. Now it's even lower than that. Donc, vous pouvez voir ici que ça, c'est vraiment l'acquisition au niveau des cas positifs dans notre région. En effet, ces couleurs bleues ici démontrent les cas de contact d'approche. Et l'orange ici démontre qu'on n'a pas décelé où ça vient. Donc, vous pouvez voir clairement qu'ici, récemment, la plupart de nos cas sont acquises de quelqu'un de proche, de contact d'approche. On peut voir ici le mauve ici. En mois de mars, avril, on avait pas mal des pourcentages importants des personnes qui retournaient de voyage, mais ici, on a moins de voyagements et en effet, récemment, on a peu ou très peu des personnes qui ont voyagé. Ici, le bleu légère ici démontre les flambées que nous avons et ça, c'est plutôt dans les institutions. Mais vous pouvez voir clairement que dans notre cas, la plupart des cas viennent des contacts de proches. J'ai mis celle-ci pour vous démontrer aussi la différence. Ça, c'est à l'échelle ontarienne. Et vous pouvez voir que, encore, initialement, c'était beaucoup des personnes qui retournaient des voyages. On avait un petit pic de voyage ici, mais vous voyez ici que ça persiste au niveau, c'est pas mal important. Ici, cette vert, bleu, ici, cette couleur ici, on voit que c'est une persistance au niveau de contact d'approche. Notez ici qu'on a un pourcentage important ici de gris avec manque de formation. Et ça, c'est plutôt relié au fait qu'à Toronto et Peel, on a débordé, on n'a pas la chance de faire le tracé de contact, donc on n'a pas d'information. So this is to compare again. If you're looking at what we're seeing provincially, again, if you notice, initially we've had increase in cases. Majority were really travel related, which is the purple here. Outbreaks here, and then steady kind of this blue-green area here, which is a close contact. And sort of a known epi link here, which kind of hasn't changed too much. But if you can notice here, which is different from what we're seeing in our picture, there's a fair percentage of people here that have missing information. And so that's because this is driven by the large numbers in Toronto Public Health, GTA area, where they're so overwhelmed. I mean, today, they get 1,000 cases a day, 1,300, some up to 13. And so it's hard for them to do the persistent contact tracing to really get that information. So that's why it's important for us to maintain our contact tracing. This is another graph that I wanted to share with you, and again, it shows us sort of the progression of tests that we're doing on a weekly basis, starting from October, and then you could see the rate of positivity, which is this dark blue line here, and it brings us up to our most recent one, which is in the 5% area. So you could see we were at 2.4%, and then right now, we were sort of up to the 5% area. Provincially, it's higher than that. It's about 7-8%. But again, it just shows you that. Donc, au niveau de pourcentage de tests positifs, vous pouvez voir que ici, la ligne bleu foncé vous démontre qu'on était ici, on était comme à 2%, on a diminué à presque 1% ici, puis là, on commence à augmenter, puis vous voyez, on a augmenté, on a doublé en effet dans une semaine, et donc on voit ça dans nos chiffres. Effectivement, on voit ça dans nos chiffres. We see the rise and increases in cases. We see that with our caseload that we're seeing. This is just a sort of a provincial trend that shows us the overall positivity rate, which, as I said, is 7%, and we are about 5.2%. We're kind of in the top 15 or so in terms of positivity rates. Donc, vous pouvez voir ici, ça va jusqu'au 2 janvier, et en effet, nous voyons ici que nous sommes dans les, je pense que les premières 10, 12 des bureaux de santé avec le taux de pourcentage plus élevé, mais vous pouvez voir, c'est beaucoup plus élevé dans les régions de Peel, Toronto, etc. La moyenne en Ontario, c'est à peu près 7 %. Nous, on est à 5,2 %. Et nous avons un autre chiffre ici, et ça, c'est comme la même chose. On voit, nous, on est jaune, c'est difficile à voir. Vous pouvez vous voir ici, on est jaune. Donc, on a commencé plus bas, puis on augmente et on compare les autres, comme ici, par exemple, ça c'est Toronto, Peel, etc. This is just a comparator similar to the graph that I showed you. But this next one that I want to show you is an interesting one. It shows you the percentage of positives by age group. And interesting that you can see the red is about 12 to 13 years old. And then we get another one here, which is the black one here is overall. But you can see it's driven by, the highest one is among 12 to 13-year-olds here, where it's about 20% positivity rate. This purple one here is 4 to 11. And you could see sort of, it's interesting the shift that we're seeing with those sort of younger age groups being positive. Before I go to the next one, I'm going to stop sharing this one, and I want to just go to another slide that I want to go over very quickly. I just want to quickly show this, and this is something that we just got it off the press right now. I'll be presenting this to all the municipalities, including Cornwall this evening, and Glengarry, North Glengarry this evening as well. I will be presenting this data and an update to all our 17 municipal councils over the next couple of weeks. Donc, je vais commencer je vais faire une présentation aux 17 conseils municipaux. On commence aujourd'hui avec Cornwall et North Glengarry, je pense, ce soir. Je vais donner aussi une mise à jour aux 17. Ça, c'est vraiment une résumé vite. On va voir ça sur nos sites web. Mais on peut voir aussi, on parle juste des derniers cas. We're just talking since the last 3 or 4 months now, leading into that. And you could see this is kind of an acquisition where people got it, how they got it. So you could see that overall for our health unit here, 61% of our cases were actually close contacts. And then if you go into that, you could see that the majority of those close contacts were household, but then you could see here about 25% were either workplace or close friends or associates, or visiting somebody or at the workplace that you could see. And what happens is these individuals then go home and infect their households. And that's what we're seeing. Donc, on peut voir ici qu'à la moyenne, ça c'est les statistiques de bureau de santé en général, mais on va vous montrer ça par Comtés unis. Vous pouvez voir ici qu'on a à peu près 60%, 2 tiers à peu près des cas qui sont des contacts de proches. Et nous allons ici, la division, on peut voir que parmi presque la moitié ici, en effet, plus que 60%, en effet, le contact de proches sont vraiment les personnes qu'on demeure avec dans notre foyer. Mais vous pouvez voir ici, en total, 25% en total des cas sont des amis ou des associés ou dans le travail. Donc qu'est-ce qu'on voit? C'est que malgré que c'est moins qu'à la maison, on voit que c'est un effet multipliquant. Donc, une personne qui contracte ça au travail va à la maison, elle va infecter ses enfants et épouses, etc. Et ça, c'est ça qu'on voit. Donc, la plupart de nos cas sont des contacts de proches comme ça, et on voit soit que le contact va être fait au travail, ou ça va être fait avec un ami ou une visite d'amis, etc., sans les précautions en place. Et en effet, on retourne à la maison. So this is important because this is what I call the multiplying factor. We get it in the workplace, we get it visiting friends, or not taking the associate, not taking care of the precautions, and then we go home and we spread. It's the multiplier effect. And then we could take it down. This is the Prescott-Russell numbers here. And again, you could see similar trends. The blue healthcare means it really is long-term care. But you can see, again, very little in terms of others. But again, significantly here, this is more than half. And again, you could see kind of the breakdown in workplaces and close friends, and then goes home and it multiplied. Same thing we can see in SDNG. Again, we have here it's 68% of the cases. And here we can see that we have a lot of close friends and more close friends and associates. And that makes up about 30% of all the cases. And then they go home and they spread it in the household that way. So c'est la même chose pour, on voit vraiment le même type de division. In terms of Cornwall, again, most of the cases are close contact. And again, 15% of total are close friend or associate. About 10%, about 8% are workplace. And again, the multiplier effect where it goes, where they go home. And a lot of the cases that we've had in the Cornwall and other areas have had, 5-6 people at home get positive. So if you have if you have like 4 or 5 or 6 of those, it adds up the cases. So that's what we're seeing. Donc c'est ça qu'on voit à Cornwall aussi. Vous pouvez voir que à la moyenne, c'est ça au niveau de contact de proches qu'on voit. This is basically trying to figure where the community exposure is. So we're looking at cases where we can get them single unit dwellings. Again, really home. This is where it shows you where it is. School, fitness, gym, and so on. This is out of the 148 cases that we had community exposures. This is where we are with that. All this will be put on our website. Now it's just more of a sort of a quick summary that I wanted to give you, but just give you an idea of, again, out of the 148 cases in general. And then you can see how we break it down here in terms of a single unit dwelling out of the 48 cases that we've identified community. Again, you can see where you get them, per that. So in Cornwall, it's most of them are single unit dwellings. Then we get elementary, you get secondary school, food premises, restaurants, workplaces, and so how you get the numbers that way as well. And then you could sort of break it down into, Prescott-Russell and SDNG, and then you could see sort of most of them are single unit dwellings. And then with the Cornwall, again, you can see that we've had basically single unit dwellings. Again, this is more when you get it in the community. And then you get the food premises here, manufacturing plants. This is out of 148 cases or so. And then, no, less than that, 148 total, but this is broken down into Cornwall. And you can see that some of the settings that we see. So the most frequent one is, again, in terms of outside of the home is we saw restaurants, manufacturing plants, secondary schools, financial institutions, workplaces, multi-unit dwellings, and so on. So you could see how we break that down. Donc au niveau de ça, c'est vraiment où on a acquis. Donc, on a les statistiques qu'on remonte à Prescott-Russell. Donc, on voit école, gymnase, etc. À Prescott-Russell. SDNG, c'est plutôt à la maison. Et aussi, on voit ici au niveau de contact à l'école. Et à Cornwall, la même chose, on voit ici. Donc, ça, c'est les statistiques que je vais partager avec toutes les municipalités dès aujourd'hui, en effet. So that's where we are with those numbers. I just want to go actually now. I will. So moving forward, we're going to now talk about something else, which is vaccines, and I will give you a bit of an update on those. Again, I think I just have to share my screen once again. I have my other presentation here, so we'll share the screen, and we'll bring up this presentation here, and we'll bring it there. And we'll share it here. So what we're seeing here is essentially a distribution plan, this is a provincial plan where we have the different phases of vaccine, where we start with phase 1 and then phase 2 and phase 3, and this is what's sort of central. So as you know, we talked about high-risk population vaccination. So we're actually starting our phase 1 this week, and starting with congregate living settings, long-term care facilities, retirement homes, progressing to with healthcare workers, progressing to First Nations, and so on. So this week for us, we will be receiving Pfizer vaccine and Moderna vaccine, and we will be distributing it starting to with our colleagues at EMS to our long-term care facilities. Our goal is to vaccinate all long-term care facilities as quickly as possible. We'll be starting this week, and we're also we're receiving vaccine supply for Akwesasne, and they will also vaccinate their long-term care and retirement homes as well. We will then progress. We will also be starting to vaccinate our healthcare workers. And as vaccine comes in into phase 2, and again, phase 1, this one's done on Pfizer and Moderna vaccine, so it doesn't include the other vaccines that will come into play. So the timelines may shift. So we're thinking around February, March, February or so, end of January into February, depending. We'll go into the other, which is phase 2, essential workers, adults, different age groups, and so on, and then moving forward to everybody. The timelines, I purposely did not put dates there because they will be shifting. So for now, the good news is we're starting. Donc, au niveau de vaccin, ici, ça c'est le programme, le plan provincial que nous avons ici. En effet, nous allons voir déjà, on commence cette semaine. On va recevoir nos vaccins de Pfizer cette semaine. On attend soit demain ou mercredi. Et on va commencer avec nos équipes en partenariat avec nos équipes mobiles des paramédics pour aller commencer à vacciner les maisons de longue durée. Notre but est de finir la première dose le plus vite possible dans les maisons de longue durée et après ça, on commence avec les maisons de retraite et en même temps, on va commencer nos vaccinations des médecins des personnes qui travaillent dans les hôpitaux, surtout dans les hôpitaux qui prennent soin, qui sont en risque avec COVID, qui traitent les patients de COVID. Nous allons recevoir aussi cette semaine des doses pour Akwesasne et aussi Akwesasne va commencer avec les maisons de longue durée et les maisons de retraite. Et nous allons continuer vers ça va nous prendre jusqu'à fin janvier, mi-février. Phase 2, on va commencer avec les travailleurs essentiels en première ligne, etc., avec les adultes âgés. Et le fur et à mesure, quand les vaccins vont venir, les volumes vont augmenter, on va commencer avec tout le monde. Tout le monde va l'avoir. En effet, on va commencer avec le bureau de santé qui vont le faire, mais une fois qu'on a beaucoup, le vaccin va être disponible aux pharmacies, aux médecins et centres communautaires, etc. Just wanted to say that. Et aussi, ceci, c'est plutôt pour Pfizer et Moderna. En effet, si on rajoute des autres doses d'autres compagnies, à ce moment-là, le timing, le commencement de progression de phase 1 à phase 2 va aller plus vite. Je pense que ça va arriver. Donc, pour le moment, on est là. Bonne nouvelle, c'est que nous allons commencer cette semaine dans notre région et nous allons continuer. J'avais confirmation que je vais recevoir les vaccins une fois par semaine, confirmé jusqu'au fin janvier. Et là, on va recevoir nos plans d'allotement de vaccins pour février bientôt. We're going to be getting vaccine on a weekly basis. That's been confirmed to us, and it's been confirmed throughout the month in January. And we'll be getting momentarily, actually, the allotment for February for us. So I do believe that the timelines will likely be increased because we'll start to see vaccine flowing. Right now, we're having, it's trickling out, but it's gonna really let loose very, very shortly, particularly if we get another vaccine approved. So that's where we are with a vaccine. I have some questions here that I've been given. The first question is, what appears to be the early impact of Quebec's new curfew on the EOHU region? Is it having an effect of driving more Quebecers into our region? I have heard that we have had some complaints over the weekend, Nelson, about Quebecers coming into I think, Cornwall. And so that is an issue. I'll be bringing that up with our MPP. you're contemplating imposing some curfew in Eastern Ontario. Well, I can tell you that there's going to be some there's going to be some provincial decision made likely tomorrow on increasing resistance. Everything's on the table. I'm not sure what the government is going to go with, but I can bet you that there will be increased restrictions. There will be, what we're trying to target really is people mobility. Stay home as much as possible. Stay home as much as possible. So I think that there's going to be more strict sort of orders of stay home. I'm not sure what they can do but travel. But certainly that's something that they're going to be there, and I'm sure that they're going to as well redefine essential services. So they'll close down some more businesses that are deemed non-essential. So the essential businesses, so to speak, will be less and less akin to what we had more in March. So I think that that's going to be going there. And so what's the other one? So again, I've never thought about legal authority, but curfew. But this will be if it's a curfew, it's provincial. My view is that they're likely. I'm not sure. I can't speak for the government, but what I'm reading is they're likely going to go for other measures. I actually today I was speaking to somebody about curfews and saying that curfews you still can't limit people from traveling and going to visit their friends. They'll do that during the day, so I think there has to be more specific directives or enforceable things that will essentially allow or to give the message that people should be staying home and not leaving. Certainly I think they might ban any public meeting, but we'll see tomorrow. I think that the cabinet is meeting today, and there will be some announcement tomorrow. But I do expect that there will be more restrictions put forward because of the numbers that we're seeing across the province and in our area as well. L'hôpital, est-ce qu'il y aura un hôpital de campagne de Okay. No, I answered that one. J'ai une question de Radio-Canada au niveau de la situation de l'hôpital de Cornwall. En effet, j'ai dit que Cornwall, maintenant, les derniers chiffres que j'avais, ils ont une capacité de 160. Ils sont rendus à 187 avec pas mal de patients de COVID aussi. Donc, ils sont à la limite. Ils ont des plans pour expansion, mais pour le moment, ils sont là. Donc, on voit ça. La vaccination commence, j'ai expliqué. We've been in a lockdown just over 2 weeks. Hugo's asking me that. Yet not abating. What more can we do to flatten our curve? Again, having to limit the mobility, having to limit people staying home more, and ensuring that we have less mobility. Mobility data shows us that people are going out. I think that we're seeing an increase that reflects Christmas right now. Hopefully that the message would be stay home, decrease the opportunities for going out. Like I said, I think there's going to be some more restrictions as to workplaces, making it mandatory to work at home if you don't have to go to work. Those type of things that I think have to be done. And again, I think there will be some announcements made tomorrow in that regard. Given the above, is more enforcement inspections. Well, we're trying to do as much as we can with enforcement. As a matter of fact, we have been speaking provincially and saying that any measures that we need to be doing and any additional measures, we need to have more enforcement. And that's something that we have made very, very clear to the ministry. Latest fatality I talked about. And Francis, I don't have the opioid overdoses, but I'll get them for you. So that's it for my questions that I've got before, and we're going to open it to the media for questions now, Jenny.
Thank you, Dr. Paul. Merci.
Jenna, I'm sorry. I got a Jenny and a Jenna working with us, so sorry, Jenna.
That's quite all right. Première question, Rémi Autier, Radio-Canada, demande: serait-il possible d'avoir des détails sur le transfert d'un patient COVID entre l'hôpital de Hawkesbury et l'hôpital de Hull? Quelles sont les raisons de ce transfert et est-ce que l'hôpital de Hawkesbury n'a plus de lits disponibles pour les patients COVID?
J'ai aucune idée. J'ai parlé avec le directeur général de Hawkesbury ce matin. J'ai pas parlé de ça, donc j'ai pas de nouvelles pour ça.
Next question, Nation Valley News. Please go ahead.
Hey, Doctor.
Hi.
I had a question. Do you know, are there any workplaces in Cornwall right now that are not associated with retail and not associated with healthcare, just an office situation that is in the midst of a kind of an outbreak? They have more than one case. Is there such a place in Cornwall at the moment?
We are investigating a few right now in Cornwall. I don't have the exact names, but I know that we're investigating a few, yes.
Okay. And I was just wondering the age and condition of the folks in ICU. Are any on ventilator? And what would the youngest one be? Is there anybody there of working age?
I don't have any statistics on that. The hospital doesn't provide me that. And today, I frankly didn't have time to even get my breakdown that I usually get of age groups. I can tell you that I think last week we had somebody in their 40s that I know, but I don't know anything else. I was trying to get, actually, you know what? I've got it hot off the press right here. Hold on.
Okay.
Let me see. Oh, unfortunately, I don't have the age groups here. I just have that we've got most of the patients we have are in the actually at the Cornwall Hospital, and then we've had a couple that were at Montfort, but most of them are there. And then we have two at the Ottawa Hospital. This one, I don't have the age groups. I'm sorry.
Oh, okay. Any on ventilator?
I think one in the Cornwall ICU, but I have to verify that. I don't have that data.
Okay. Thank you, doctor.
No problem.
Next question, Philip Blanchet, the leader. Please go ahead.
Hi, Dr. Paul. First question. The trend right now for January is that we are on track for about 900 active cases diagnosed this month. Just taking the first 10 days and kind of projecting them out. The pandemic's been here for over 9 months. You've always taken the stand of education as opposed to enforcement, the carrot, not the stick. But it's been 9 months, and people should be educated by now. So what measures are you going to try to do to try to get more enforcement in locally, not waiting for the province, but just locally, because there are police, there are bylaw officers that can do this stuff?
We are actively talking with our enforcement officers to look at that. We're trying again right now to look at some of those businesses that I talked to you about that we have to revisit. But unfortunately, some of the stuff that's going on is people getting together at home or that we can't see, so we can't enforce that. So we still have to have the educational point of view, and where appropriate, we need to have enforcement. So one of the things that we had recommended, and I'm not sure if the government is going to go for this, is really ability to perhaps stop people, and say how far, why you're outside, those type of things. But again, you're kind of stepping into people's freedoms. But on the other hand, we need to have a bit more enforcement moving forward, particularly when we have, if, for example, tomorrow they ban all public outings or public things like that. We have been working with our partners in enforcement already. We do have some issues with businesses that don't comply and so on. So we have to continue doing that. But again, you can have as much enforcement as you can, but if people are getting together, other people's homes, we don't see that, then it's very hard for us.
Okay. During the first wave, we had some numbers about statistics for how many ICU beds there were, and at that time, you had said about there being a COVID ward that was going to be set up at Cornwall Hospital with more ventilators and so on. Can you kind of update us on what the actual readiness is? Like, how many spaces is there? Because we've got 15 people that are in ICU, but not all of them are hospitalized.
15
but not all of them
are hospitalized. 15 are hospitalized.
But they're not all in this region. So what's the numbers actually for EOHU for how many spaces there are and how many events?
I do not have that. I do know, I was speaking with Jeanette this morning. They do have a full plan. I can get that information for you, but I don't have that right now. I do know that they have plan A, plan B, plan C in place. I don't know the exact numbers. I was talking to them about a few other things. I wanted to get a sense of what their types of patients that they had. So I didn't have a chance to go there, but I do know that there are contingencies for moving certain patients elsewhere and contingencies for that. They are the best people to address that too, but I can get that information as well.
Okay, great. Thank you.
No problem.
Next question, Natalia Goodwin, CBC. Please go ahead.
Hi, Dr. Paul.
Hi.
So just with those hospitalizations, are you worried that the system is going to become overrun, seeing your cases climb and climb and climb?
Yeah, I am worried. And that's precisely, we're worried at the local level, but we're also worried at the provincial level. And so that's why I'd like to be able to, again, ask people as much as possible, stay home. Stay home, don't go out, don't travel. Do not go out unless it's necessary. Take care if you have to work, obviously. Make sure that you have the proper precautions. We're going to look at all those blind spots as well.
Okay, and in those numbers that the new numbers you were presenting, that 12 to 13 age group was quite interesting to me. Do you think that kids should be going back to school given those numbers?
Well, I can tell you that those were acquired outside of school. And so most of the cases that we saw in school, and these as well, because a lot of these that we saw in our area as well, in that age group occurred really right after, when there wasn't school. So this was acquired over the holidays. And obviously the more people you bring into schools with positive cases or percolating a case, right? And then that's one of the reasons that we didn't want to open the schools, not because we thought the schools would propagate it, but what would happen is if we have a lot of kids going, then we'd have to go in and a positive case here, positive case there, particularly if staff were positive. What we had seen pre-holidays is that a couple of schools had to close, not because they had an overwhelming number of cases. It's because the staff, for example, one individual would come in, they'd have lunch together, and they would, potentially have 5 or 8, sometimes higher, high-risk contacts that had to be isolated. And because there were so many people absent, they had to close the school down, not because there was a lot of outbreaks, that's because of those things. So you can imagine the amount of disruption that we would have with these number of cases going into the school or developing in the school something that they picked up from outside. So if you just multiply that, you can see how chaotic and difficult and disruptive it would be. So I think in retrospect, it was a good decision that the kids stay at home. I know that there are, consequences, particularly difficulties for single mothers and daycare and those type of things. But on the other hand, it's a lot of disruption for the classrooms. And imagine if we only had, several cases at a time in our schools. I think when I last saw the numbers, we were at something like 40 cases in 25 schools or something like that, since the beginning. And now I know that I've seen the age ranges, and there's a lot of them. And I haven't even been able to look at that, but I'm sure there are people that would go back and work or that have been exposed and go back. So I think at this point, with those numbers so high, again, we always say it. And it's not a coincidence, by the way, that we're now starting to see increases of outbreaks, for example, in long-term care facilities, because we're seeing high levels of community. It's going to be transferred into those facilities, including long-term care and schools.
Okay, thank you so much.
You're welcome.
Prochaine question, Kenza Beladi, TVA, Gatineau, Ottawa. C'est à vous.
Bonjour, est-ce que vous m'entendez bien?
Oui.
Oui, je vais vous faire un peu répéter. Vous avez répondu à la question en anglais. C'est en lien avec cette importante hausse des cas du côté de l'Ontario. On sait qu'il y a sûrement des restrictions qui seront annoncées de la part du premier ministre demain. Vous vous attendez à quoi, là? En regardant cette situation, vous vous attendez à quoi de la part au niveau des mesures, là?
OK, moi, je pense que sûrement, on va viser la mobilité des gens. Il va y avoir des restrictions qui vont vraiment confirmer le besoin de rester chez eux. Donc, peut-être, je ne pense pas qu'il va y avoir un curfew comme Québec, mais il va y avoir des restrictions, il va y avoir peut-être des ordonnances de rester chez vous à moins à faire des choses essentielles, aller au médecin ou aller magasiner, limiter peut-être les personnes qui vont aller magasiner une à la fois, pas toute la famille ensemble, restrictions au niveau de description de qui va être essentiel. Autrement dit, il va y avoir des fermetures des autres commerces pour diminuer la chance que les gens, ou la raison pour laquelle les gens vont sortir de leur maison. En effet, c'est la mobilité. Il faut viser la mobilité dans ces établissements et de la maison. Donc, je pense que ça ils vont annoncer un truc de de restrictions qui vont vraiment viser de prévenir la mobilité pas forcer, mais encourager les personnes de rester à la maison le plus possible, de peut-être ordonner ou mandater de rester chez vous, travailler chez vous si ce n'est pas nécessaire d'aller au travail, etc. Donc, dans ce sens-là, je ne pense pas que ça c'est mon avis, qui vont avoir la même chose d'un couvre-feu qu'on a, un couvre-feu qu'on a à Québec. Je pense qu'ils vont aller avec ça, mais sûr et certain qu'il va y avoir plus de restrictions demain.
J'ai une deuxième question pour vous. Vous en avez parlé aussi un peu plus tôt au niveau du couvre-feu du côté du Québec. Vous avez dit que vous avez même reçu et que vous aviez reçu des plaintes au niveau de Cornwall. Expliquez-nous un peu la situation.
En effet, de notre gestionnaire ont reçu un appel, je pense, de la police de Cornwall, soit ce matin ou hier, en disant qu'ils ont constaté qu'il y avait beaucoup des autos avec la licence de Québec qui sont venus à Cornwall de magasiner. Ceci a causé un peu d'angoisse au niveau des citoyens de Cornwall. Et ça, c'est une chose que me préoccupe aussi parce que ce n'est pas la première fois qu'on voit ça. Donc, je vais en parler encore avec M. Jim McDonnell, qui est nos représentants provinciales locales, avec mes craintes. Malheureusement, je ne peux rien faire. Je n'ai aucune autorité pour le voyagement interprovincial. Mais encore, c'est un problème qu'on avait en mois de mars-avril et j'ai entendu dire qu'on avait la même chose récemment.
Merci beaucoup.
Pas de problème.
Next question, Bill Kingston, Cornwall News Watch. Please go ahead.
Hi, Dr. Paul.
Hey, Bill.
Happy New Year. And thank you. I wanted to ask you, first off, Cornwall City Council meets tonight. They're going to ask you in the health unit and the province to enforce the essential services, that essential businesses only sell essential goods. They say that they want the directives applied fairly across the board. What do you make of their ask?
I asked it over the weekend, actually. I asked it, I sit at the public health measures table, and that was one of the things that I requested. We had an urgent meeting on Saturday, and I've actually asked that several times before that, even before this. And I think that should be one of the measures that they take right now. I'm expecting that tomorrow. I'm hoping that they announce it tomorrow to not only level the playing field, because they've done it in Quebec. In Quebec, the big box stores are only allowed to sell essentials, groceries and pharmacies. And I was expecting them to do that this time around with this lockdown, but they didn't. I've actually raised my concern twice again, and over the weekend, I know that that's on the table. I'm hoping that they go for that. I think that is not only a fair and equitable way for that, but also it'll reduce the number of people in the store. Because again, we want less people mingling, less people out.
Okay. And my follow-up is they're also looking at asking about the data that you presented this afternoon is going to obviously be published. And one of those is about sector data of where infections are, be it barbers or hairdressers or fitness centers. Do you think that this data that you presented today, do you think that will satisfy the city's request and the mayor's request that they've wanted more data?
This is the much data that we can get right now. And at this point, I think that the main important thing was that you saw it was all close contacts. That was the main thing. So, and we saw the majority of were household contacts, and then there was a slither where you get that either in workplaces or wherever. The most important thing is that people were not following public health precautions. They were obviously not taking the necessary measures. They got infected, they went home, and it multiplied. So I think so we do have the numbers. Those are as granular as we can get them with what we have. And I had, we struggled to put them together. It was very hard because we're in the middle of changing the program. But that's the data that we have, and it's clear and it's consistent across whether you have a couple of cases in a restaurant or not. That's that little slither that then multiplies itself when you have close contact. So it is important to know that when we leave our guard down, when we're going to friends' houses, and or working with our colleagues or at work, that then becomes, a source of infection for the whole family. And that's what we see. That's exactly what we're seeing.
Great. Thank you very much.
Thank you.
Next question, James Morgan, The Review. Please go ahead.
Hi, Doctor. It's been a while. Anyway, my question is, you mentioned there were reports in Cornwall of out of province shoppers at various stores, malls, whatever. Did you hear anything about what was maybe happening in Hawkesbury?
I have not. I will ask. I have not at this point. I wouldn't be surprised if I had the
I
same.
can confirm I saw it with my own eyes, but anyway,
hasn't reached me yet as a complaint.
What's that?
Hasn't reached me yet as a complaint.
It has not reached you as a complaint.
No.
Are there any COVID-19 patients in the Hawkesbury Hospital?
At this point, no.
Okay. Okay. Thank you.
Okay, you're welcome.
Do it. Good.
Those joining by phone have questions. Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. We have one more from the chat box, Dr. Paul, if you have the time.
Sure, one more.
Philip Blanchet, the leader, please go ahead.
Hi again. So about vaccines, the province has its ethical framework for distribution of vaccines and the hierarchy of where it's supposed to go, first frontline workers and etc. But there have been some calls to focus the health unit's efforts on where the need is greatest, meaning the large number of infections in Cornwall. Do you support the province's framework, or do you think we should take more of a targeted local approach?
I think that you have to look at the vulnerable populations first, and go where the deaths have been, and they are in the long-term care and retirement homes. So I support the province's approach. Nothing stops us from tapering it locally, but we definitely have to go for the more vulnerable ones. And that's what we're going to be doing. The framework has general guidelines, but within that we have a flexibility. For example, certain age groups, we can maneuver one area versus another as long as we're within that framework. So that's been made very clear to us by the general himself, that we have that flexibility locally. My hope is that we get the vaccine, so we'll be able to make those choices quicker rather than later. But I'm encouraged that we're getting the vaccine. I know that not all health units have been getting it. It's been trickling out, but we're getting it this week, and we will be starting with those most vulnerable. Looking at if you look at our deaths, most of them came from long-term care.
Okay, thank you.
You're welcome.
Those are all the questions for today, Dr. Paul.
Thank you very much, everyone. Merci.